he is still stable medically, and the improvement that we're seeing is that he is more alert. He is talkative, asking questions about his course and what he's doing here and what we're doing to help him. Also, he has been corresponding with his family via a teleconference, and he was able to speak with them for about half an hour today. His family was able to read him some verses from the Bible, and he was able to actually ask for a Bible on his own that he could read in the room. And so we're just seeing that he is more alert than he has been since he arrived at our facility. I believe that's too soon to say at this point. We are encouraged by his progress, but we also have to remember that he's still very sick.
The disease we're dealing with, Ebola virus, is something that can have phases, and it can start out and improve, and then later get into difficulty with other medical complications. So it's far too early to relax and say we're out of the woods, but we're encouraged by what we see. ZMapp was used in both patients at Emory, and that's no longer available at the present time. We are using a research drug, and I can't give a lot of details about that, but I can just say that we, after talking to people at Emory and the CDC, we were able to determine a drug that has some promise, and we're using that. I have to say, I've been in his room for several hours every day, and he's a really fine person, a very humanistic person. He's even got a nice sense of humor, and we've chatted about a number of things. As he's waking up, he's demonstrating interest in a number of things, and the desire to communicate with his family, as Dr. Hewlett mentioned.
I think we really have to take this day by day. We are monitoring him as we would with any sick patient. In our critical care parameters, things for checking lab work, watching his vital signs, watching him. I think we have to keep in mind that although he has a disease like Ebola, he also is a patient, and we as healthcare providers treat sick patients every day, and so we're doing the same things for him that we would for any other sick patient in this hospital.
Virtually the same strain, and I've been on the phone to Emory people every day, and to other people who have some experience in treating Ebola every day. The professional community has been extremely helpful. Dr. Hewlett had a conversation with physicians in Liberia, and they've been able to all share little bits of information that have been helpful. He's been one of our best sources, and he took care of patients who had Ebola, and he has Ebola himself, and as a physician, he's a very astute observer, and so he's able to talk to us even though he's weak and certainly not anywhere near full capacity. He's been able to give us a number of tips on the natural history of Ebola virus and an approach to it, and the importance of fluid replacement, for instance, which was not always available in Africa.
As with any sick patient, I think that we are also taking into account other concerns, not just his medical care, but also his spiritual and his sort of the non-tangible issues that we all worry about when we take care of patients who are this ill. And I think that talking to his family, being able to converse with them and go back and forth with them has been helpful to him.